Welcome to the tutorial, How to Use the Child Psychopharmacology Institute Treatment Monitoring and Management Program. This tutorial follows our tutorial Introduction to Monitoring Children's Medications and shows how to easily set up an observation subject, begin making observations, and produce reports. The United States Food and Drug Administration recommends that children and adolescents receiving antidepressant and other medications be closely monitored. This program is an efficient method to do so. The following screens will show you how to set up an observation subject, enter the circumstance data, complete the first observation, make subsequent observations, and view and create reports. This is the screen you'll see when you start your application. Simply click on the button to set up an observation subject. To begin your observation series, enter the observation subject's name and related information. When you enter the birth date, the age will be calculated. Allison was used for this example. You will put in your own information and then click the next step. This information serves as a snapshot of the biopsychosocial and treatment circumstances that exist at the time the observations are beginning. In some cases, this may happen before a medication trial and follow through the process of monitoring and measuring the response to treatment, or in other cases it may be begun during the course of treatment. Identifying primary concerns and the other information such as environmental stressors results in a well-organized, simple report that can be shared with your physician as you discuss your concerns and possible strategies. Predefined items are provided within the program by hovering the cursor over the item name, and they are also available online. In addition to these predefined items, primary observers can create user-defined items to measure as well. Most parents designate or agree on which parent will be the primary observer. However that is decided, the primary observer should remain the same person for each subsequent observation. Even though these items are predefined, individuals still perceive these items through their own lenses. There can, however, be more than one primary observer. That is accomplished by setting up the observation subject again with a different primary observer described more completely in the book. Now you're ready to make your first observation. This is the standard observation form you'll be filling out. For the first observation, we recommend that you characterize the previous 30 days with subsequent observations representing the time from the last observation. You'll see there are drop-down boxes that you can select with numbers 0 to 100, representing the percentage of time that you observed the issue or items listed. The drop-down boxes for numbers is defaulted to be 0. As a result, if you don't see or observe an item, you can simply skip over it and it is measured as 0. This greatly improves the speed of making observations of many items while still noting items that are absent or not observed. While the numbers are offered by increments of 10, any number under 100 can be entered. Entries of observer comments are helpful when reviewing treatment and comparing treatment variations. Special problem tracking items can be selected using a drop-down list available or by entering your own user-defined items. When reviewing several months or more of treatment, it is very helpful to see your earlier comments. For many, it is an opportunity to see how far they have come and place current concerns in perspective. This graph of 16 observations over a period of about a year and a half of treatment reflects a significant reduction of symptoms in a child being treated for depression and anxiety. Thank you for watching this tutorial. We encourage you to watch our other tutorials and hope you find them helpful.